A 42-year-old female presents to the emergency department with a GCS 6/15. She is intubated and ventilated prior to performing a CT scan of the head. This reveals a subarachnoid hemorrhage. On transfer to ICU, the patient desaturates to 88%, despite increasing FiO2 of 1.0. Lung compliance is reduced and CXR reveals bilateral interstitial shadowing. ECG shows widespread T-wave inversion. Troponin I is elevated at 1.4 and echocardiogram demonstrates a mildly impaired left ventricle. The most likely diagnosis is A. B. Acute myocarditis. C. Neurogenic pulmonary edema. D. Has breathing difficulties. You are fast bleeped to the emergency department because there is a 1-month-old infant who has breathing difficulties. The pediatrician suspects bronchiolitis and is considering intubation and ventilation. Which one of the following is the greatest clinical indication for intubation and ventilation? Recurrent apnoic episodes with increasing frequency. E. A 48-year-old male with advanced HIV disease on antiretroviral therapy complains of severe burning pain and paresthesia in the soles of his feet. On examination, ankle jerks are absent and there is blunting of sensation and vibration in both feet. With which of the following is this best treated? Pregabalin 300 mg BDH. Pregabalin 300 mg BDH. Pregabalin 300 mg BDH 17. You are asked to review a 25-year-old man who has been on ICU for 4 weeks with cervical cord injury, C6-7. He looks sweaty and is complaining of a headache. He has been oliguric for 2 hours, but prior to that his urine output had been good. His blood pressure is 220/100 mmHg with a heart rate of 35 bpm. What is the most likely diagnosis? A. C. Sympathetic hyperreflexia. D. Patients with chronic liver disease will often be anemic. Which of the following is not a recognized cause of anemia in patients with chronic liver disease? Hypoerythropoietin. D. Which? Malnutrition. H. 19. You are involved in the management of a mother with a major postpartum hemorrhage, PPH, secondary to uterine atony. There are numerous pharmacological agents available to help you manage this situation. B. Which of the following drug doses is incorrect? A. Oxytocin -5 units intravenously. B. Ergometrin 0.5 mg intravenously. C. Oxytocin infusion -10 units H intravenously. D. Carboprost -250 mcg intramuscularly. E. Misoprostol -400 mcg rectally. H. 20. A 2-year-old child undergoes surgery to amputate a finger following ischemic damage from a tourniquet that was left on unnoticed. The parents consider the doctor who left the tourniquet on to be negligent. As the child grows up, he decides to sue the doctor for negligence. The child is now 14 years old. By what age must the child start proceedings for his case to be valid? A. H. There is no time limit. H. There is no. D. 21 years old. E. There is. H. A 50-year-old man presents to your chronic pain clinic for a review of medications. He has been using a fentanyl patch for lumbar back pain for 5 years with the current dose at 75 mcg/h, as well as pregabalin 150 mg twice daily. During the course of the interview he admits to a low libido and that it has left him feeling depressed. What would be the next step in your management? A. Advise his GP to start a course of sildenafil. B. Check his testosterone levels. C. A. E. H. 22. Which of the following is least important in optimizing the delivery of transdermal drug preparations? A. Molecular weight less than. A 22-year-old active cross-country runner presents for an open reduction and internal fixation of a non-united ankle fracture. Despite immobilization for 8 weeks and administration of paracetamol, ibuprofen and codeine in appropriate doses, the patient complains of severe pain in the foot. The foot is cool with smooth skin and obvious allodynia and hyperalgesia. The most appropriate anesthetic technique for this patient is A. E. Including combined spinal epidural anesthesia with postoperative multimodal analgesia, including epidural local analgesia. E. Spinal anesthesia. D. Combined spinal epidural anesthesia with postoperative multimodal analgesia, including epidural local analgesia E. A 2-year-old child is listed to have an inguinal hernia repair. You decide to perform a general anesthetic with a coil epidural. Which of the following coil epidural drugs and doses are appropriate? A. B. 0.25% bupivacaine 1.0 ml kg C. Age 25, a patient with an isolated head injury is brought into the emergency department. The ambulance crew state he fell from a garage roof, hitting his head. He has been unresponsive, but vomited in the ambulance on the way to hospital. His blood pressure is 160/90ths mmHg, HR 90/min, SPO2 98% on a 15 liters mask with a reservoir bag. He is on a spinal board with a cervical collar and blocks in situ. When the emergency department specialist registrar performs a sternal rub, the patient groans and flexes both arms. His eyes remain closed. The emergency department registrar wants to perform a CT scan of the patient's head and C-spine. The radiographer is ready and waiting. Which of the following is the most appropriate course of action? E. Turn the patient lateral. D. Perform a rapid sequence induction and take the patient to the scanner sedated, intubated and ventilated. E. Perform a rapid sequence induction and take the patient to the scanner sedated, intubated and ventilated. E. A. To the Connecticut scanner H26, which of the following respiratory pathogens has been shown to be resistant to rifampicin? A. C. Pseudomonas aeruginosa. D. H27, a general practitioner refers an 80-year-old lady to the chronic pain clinic. The patient reports burning pain on her trunk since an episode of shingles 2 years previously. She has been on gabapentin and amitriptyline for the last 3 months with minimal improvement in her symptoms. Which of the following would be the most appropriate next step in her management? A. B. Prescribe 5% lidocaine patches. C. H28, a 57-year-old normotensive female presents with a grade 2 subarachnoid hemorrhage secondary to rupture of an anterior communicating artery aneurysm. The aneurysm is coiled uneventfully and she is admitted to the critical care unit for observation. 3 days later she develops weakness in her right arm and leg. Brain-computed tomography, Connecticut, is reported as normal. Which of the following is the most appropriate initial intervention? E. Commencement of nimodipine 60 mg Ng/4 hourly and maintenance of systolic blood pressure of 180 mmHg. H29, paravertebral blocks can be used for both acute and chronic pain in a variety of anatomical locations. Which of the following is most accurate? E. Severe coagulopathy is a relative contraindication. Age 30, a previously fit 80 kg 59-year-old Afro-Caribbean man is in hospital with an acute ascending polyneuropathy. Which of the following observations is most sensitive predictor of need for critical care? D. A vital capacity of 900 milliliters. E. You are anesthetizing a patient for percutaneous continuous radiofrequency (CRF) therapy for trigeminal neuralgia. Which of the following statements is incorrect? Which of the following statements is incorrect? A. Patients are likely to be on antipileptic medication. B. CRF therapy is a highly effective treatment for trigeminal neuralgia in the majority of patients. C. It is common for patients to be awakened during the procedure. D. CRF uses alternating current applied continuously at 100-500 Hz. E. The trigeminal ganglion is approached via the foramen oval. J2, a 56-year-old female with a history of ischemic heart disease presents to the pre-anesthetic clinic for assessment prior to her thyroidectomy for multinodular goiter. She had had STEMI 18 months earlier and drug-eluting stents placed in 2 coronary vessels, one of which is the left main stem coronary artery. She has been placed on clopidogrel and aspirin, and you have been asked to consider the best course of action regarding her antiplatelet management perioperatively. What would be your best option in her management? D. Cease the clopidogrel, consult cardiology, consider short-acting GP-IBA antagonist bridging therapy and continue with aspirin until the day of surgery, recommencing clopidogrel with 600 mg loading dose on postoperative day 1E. J3, a 62-year-old man presents with fever and confusion. He is agitated with a Glasgow coma score of 7 and is intubated in the emergency department. He has a pansystolic murmur. A transoesophageal echocardiogram reveals extensive vegetations on the native mitral valve. A gram-positive organism is cultured from blood taken on admission. The most likely organism is B. Streptococcal species C. J4, central neuraxial blockade is used frequently in obstetric anesthesia and analgesia. Its use is not without complications. Postpartum headache is a common occurrence. Which of the following is most accurate? A. E. Sudden onset of headache with accompanying nausea requires urgent neurological investigation. J5, a 64-year-old gentleman is admitted to the neurocritical care unit after undergoing craniectomy for an acute right-sided subdural hematoma. 6 days later his serum sodium is reported as 128 mol/L. Serum osmolality is reduced, his central venous pressure is 1 mmHg and he has reduced skin turgor and dry mucous membranes. Urine output is 200 ml per hour. Which of the following would be the most appropriate treatment for this patient's condition? D. 0.9% sodium chloride E. A 23-year-old woman attends the chronic pain clinic. She reports a 9-month history of increasing pain and immobility in her right hand. She is otherwise well, but on questioning reveals that she previously badly broke her right forearm and spent a prolonged time immobilized in a plaster cast. From your history and examination, which of the following features is least important in diagnosing complex regional pain syndrome (CRPS)? C. The history of the fractured and immobilized arm. D. J7, which of the following treatments are most useful in the treatment of life-threatening asthma? C. Hydrocortisone and isoflurane. D. J8, a 58-year-old man is undergoing an elective posterior fossa craniotomy in the sitting position. 1 hour into the operation, his SpO2 falls from 98% to 92% and the end-tidal CO2 level falls suddenly from 4.5 Pa to 3.1 Ka. In addition, his blood pressure drops to 70/40ths mmHg from 105/65ths mmHg in the absence of bleeding from the surgical field. The first step in your immediate management plan is to A. Check the endotracheal tube. B. Aspirate through CVP line. C. Reduce the minute ventilation and increase VO2. D. Increase the PEEP to plus 7.5 cmH2E. Ask the surgeon to flood the surgical site. J9, a 5-year-old, 17 kg boy with cerebral palsy develops small bowel obstruction and presents for a laparotomy. Following a rapid sequence induction using suxamethonium as the muscle relaxant, a 1.7 mg dose of vicuronium is given after 5 minutes. A second dose is required slightly sooner than expected to maintain adequate surgical conditions. The most likely reason for this is A. B. An upregulation of acetylcholine receptors. C. J10, a 26-year-old patient presents for a laparotomy for an acute abdomen. The patient informs you that she was previously addicted to heroin, but has been abstinent for 2 years. The most appropriate opioid and route to add to a multimodal pain regime for postoperative pain management is B. Tramadol 20 mg every 5 minutes subcutaneously via a patient-controlled analgesia pump. J11, a 30-year-old woman was admitted to the intensive care unit 24 hours ago after presenting to the emergency department following ingestion of 12 grams of paracetamol approximately 24 hours before admission. She has subsequently required intubation and invasive ventilation after becoming increasingly encephalopathic. Despite supportive treatment, she has failed to improve. Which of the following test results warrants an urgent referral to a specialist unit for consideration for liver transplantation? E. Arterial pH 7.27 J12, a 75-year-old man presents for repair of an inguinal hernia. He has controlled hypertension and a history of ischemic heart disease. He walks his dogs for 2 miles every day and can manage 2 flights of stairs without becoming short of breath or developing angina. He tells you he used to get exertional angina, but this has completely stopped since undergoing angioplasty 6 months ago. Looking over his notes, you see that he has a Taxus stent in his circumflex artery. The patient has had severe PONF in the past and would prefer regional anesthesia. What is the appropriate next step? E. Delay surgery for 6 months J13, in order to reduce a posterior dislocation of an ankle in a 95 kg 28-year-old rugby player. The ED registrar has asked for anesthetic assistance as Antinox is proving inadequate for the task. The typical dose of ketamine to allow this procedure would be B. 4.75 ml of 10 mg C. A 15 kg 3-year-old boy is scheduled for a circumcision on an elective list. He is normally fit and well. He has no known allergies and he is not on any regular medication. After induction of general anesthesia, he receives a penile block. Which of the following is the most appropriate additional intraoperative analgesic? A. C. Paracetamol 225 mg IV, diclofenac 12.5 mg PR. J15, a 56-year-old female presents with a 10-year history of neck pain. This pain has remained at a constant level over time and neuroimaging has not revealed any surgical pathology. There are several yellow psychosocial flags from the history. Which would be the most appropriate tool to assess this patient's pain? A. C. McGill Pain Questionnaire. D. A 30-year-old gentleman with a BMI of 30 is listed for open appendicectomy. He denies any other significant medical comorbidity. You decide to perform a rapid sequence induction as he is at risk of aspiration. Which one of the following would best ensure adequacy of preoxygenation prior to induction of anesthesia? A. Maintenance of a patent airway with a tight-fitting mask. B. J17, you are asked to review a 76-year-old lady in the pre-assessment clinic. She has a long history of bipolar disorder and refractory depression. She has been listed for a total abdominal hysterectomy. The FY1 doctor in clinic has asked for your opinion regarding her medication history and any alterations that need to be made in the perioperative period. Which of the following psychoactive drugs would need to be stopped before surgery? A. Lithium. B. J18, it is recognized that volatile anesthetic agents affect liver perfusion. What would be the most appropriate volatile anesthetic agent to use when anesthetizing a patient with liver disease? D. Dysflurin E. A 35-year-old, 26-week gestation multiparous woman presents to A and E having collapsed at home. Which of the following is correct in the event of maternal collapse? D. 35% of the mother's circulating volume may have already been lost pre-hospital. J20, a 6-year-old boy falls off his pedal cycle and breaks his distal radius. He is brought to the hospital by his maternal grandparents. The X-ray shows that, whilst there is no neurovascular compromise, the fracture requires manipulation under a general anesthetic. On further questioning, the boy's mother is away for the weekend and he was left in the care of his stepfather who is married to the boy's mother and has lived with the boy since he was 18 months old. The boy's mother married his birth father 10 years ago, but divorced him when the boy was 12 months old. He lives locally but only sees the boy on his birthday each year. No court orders have been issued regarding parental responsibility. In the absence of the boy's mother, the doctor wants to obtain consent for the procedure. Who can consent? D. The boy's birth father. E. Chronic post-surgical pain, CPSP, has become recognized as a significant cause of postoperative morbidity. Which of the following surgical procedures is associated with the highest prevalence of post-surgical pain? D. Thoracotomy. E. Vasectomy. J22. Recreational diving is a popular sport in the UK despite the low temperatures of our coastal waters. Divers should be well trained in how to deal with ascent from working depths, but accidents and emergencies occur and, if faced with a diving-related injury, decompression sickness may be an accompanying problem. Which of the following is most accurate? C. Bubbles of gas can form on ascent from depths of 3 meters. D. A 25-year-old pregnant lady in her first trimester was seen by the GP for a chancre around her genital region. Her microscopic and serological tests confirmed primary syphilis. What is her first-line therapy of choice? E. Benzathine penicillin G 1.8 grams IM single dose. J24. You are anesthetizing a 2-year-old boy for elective bilateral inguinal hernia repair. When you turn the child onto his side in order to insert a cowl anesthetic, you notice that he has some irregular marks on his back and buttock. You are not sure what these are. What is the most appropriate course of action? B. Ask a senior colleague for an opinion and then contact the on-call consultant pediatrician for advice. C. J25. Following coronary artery bypass, a 67-year-old male patient is hypotensive at 87/45 mmHg and oliguric. The patient had good left ventricular function preoperatively and weighs 90 kilograms. He is sedated, intubated and ventilated following the operation. He is on no cardiovascular system supporting drugs. He has a pulmonary artery flotation catheter and measurements show the following results: SRI 2120 CI 1.6 SV 45 PCWP 16 cm H2O. What would be the most appropriate treatment? A. Noradrenaline infusion. B. Dobutamine infusion. C. Patients with cardiorespiratory disease are at an increased risk of perioperative complications. Preoperative assessment of high-risk patients to quantify risk is becoming increasingly popular. Which one of the following is not a recognized risk prediction tool for perioperative cardiorespiratory complications? A. Lee. B. Detsky. C. D. Arozula. E. Goldman. J27. You are the obstetric anesthetist on call and you have been asked to review a lady on the postnatal ward with a headache after an uneventful labor epidural 3 days ago. She describes the headache as frontal and worse on standing up. She feels nauseous and complains of some photophobia and neck stiffness. On examination, she is epirexial, she has an abduchens nerve palsy and her GCS is 15. What investigation would you do next? A. Blood pressure and urinalysis. B. J28. A 74-year-old male has had a CABG and mitral valve repair and has been weaned off a cardiopulmonary bypass. Bypass time was 3 hours and he received 2 units of packed red blood cells, PRBC, while on the pump. A thromboelastograph, TEG, activated clotting time, ACT, and arterial blood gas, ABE, have been performed post-protamine. The ACT is 160 seconds and the ABE is within acceptable limits with a HB of 7.2 grams per deciliter. The plain TEG shows an R time of 14 min, normal 8-12, and an MA of 50, normal 45-55. The perfusionist has used a cell saver. The most appropriate response is A. B. Administer 50 mg protamine and recheck ACTC. A patient with significant reflux disease is first on your morning list, commencing in 30 minutes. The patient does not normally take any medication for his reflux disease. Which of the following drugs is most appropriate? D. Metoclopramide 10 mg IV once in the anesthetic room. E. A 75-year-old man presents for an elective open abdominal aortic aneurysm, AAA, repair. Which of the following statements is most accurate? A. Elective AAA repair has approximately 5% mortality, but this is raised to greater than 15% in the presence of an S3 heart sound. K1, you are asked to review a 56-year-old gentleman in the pre-assessment clinic. 8 months ago he suffered an acute anterior myocardial infarction and underwent primary percutaneous coronary intervention and insertion of a drug-eluting stent. He is currently taking aspirin and clopidogrel 75 mg once daily. He has been listed for removal of a blocked ureteric stent at the earliest opportunity. The FY1 doctor in clinic has asked for your opinion regarding his antiplatelet therapy in the perioperative period. Which of the following would be the most appropriate management plan in this case? Stop. D. Continue aspirin, stop clopidogrel 5 days preoperatively and start low molecular weight heparin 4 days preoperatively. E. Ingestion of 50 grams. A 25-year-old female presents to the emergency department 30 minutes after the deliberate ingestion of 50 grams paracetamol. She has a Glasgow Coma Score (GCS) of 15 and there is no evidence of cardiorespiratory compromise. What would be the most appropriate initial treatment? Gastric lavage. B. Induced emesis with ipecac. D. Oral administration of 50 grams of activated charcoal. E. K3, a 45-year-old man has been removed from a furniture warehouse fire with signs of smoke inhalation and superficial burns to his legs. On arrival in the emergency department, he is breathless and drowsy. Initial arterial blood gas analysis demonstrates a profound metabolic acidosis with measured carbon monoxide levels of 12%. Practice single bed. Cambridge. A. Which of the following diagnoses and treatments is most appropriate? D. Cyanide poisoning minus 100% oxygen. E. Extreme fear of Due to his extreme fear of general a 25-year-old man requires surgery to suture multiple lacerations to his arm. Due to his extreme fear of general anesthesia, he wants the procedure done while awake. The anesthetist agrees to do this with a brachial plexus block using the interscalene approach. During the procedure the patient complains of pain. This is likely to be in which nerve distribution? C. Ulnar nerve. D. K5, a 58-year-old man with pancreatic carcinoma has persistent abdominal pain despite several attempts at optimizing analgesia. Following discussion with the patient, it is decided to perform a coeliac plexus block. Which is the most appropriate and effective agent to use to perform the block in these circumstances? A. 6.6% phenol. B. K6, you have been asked to review a patient in the emergency department. You are handed an arterial blood gas result. Biochemical analysis shows a combination of hyperkalemia and a metabolic acidosis with a raised anion gap. The most likely cause is A. Chronic renal failure. B. K7, a 3-year-old child, 15 kilograms, has been listed for a procedure under general anesthesia. The child is extremely anxious and has previously been uncooperative. The most appropriate sedative premedication would be A. D. Midazolam 3 mg intranasal. E. Midazolam 1 mg IV. K8, a 38-year-old female is presented for an epidural steroid injection. During her preoperative evaluation she is found to have a BMI of 43 and is confirmed to have had difficult epidurals with inadequate analgesia during normal vaginal delivery of her children, the last 3 years ago. The most useful adjunct to performing an epidural in this patient is A. Ultrasound. C. Fluoroscopy screening. D. Fluoroscopy screening. D. Preoperative CT. K9, delirium on the intensive care unit is a very common issue. You are asked to see a 78-year-old man who is confused and agitated following an emergency abdominal aortic aneurysm repair. Which of the following is the most sensitive and appropriate tool for assessing and diagnosing delirium in a ventilated patient? D. CAM-ICUE. Deletion of p-test K10. Asthma is an important anesthetic consideration. It is unlikely that elective surgery would proceed in case of severe asthma, but it is not uncommon to be asked for assistance if a symptomatic asthma patient presents as an emergency. Asthma can be fatal even in previously well-controlled patients, so, like many anesthetic dangers, a well-rehearsed algorithm for dealing with problems is essential. In asthma, B. Hypercapnia is a sign of reduced minute volume, but is not necessarily an indication for immediate intubation. C. K11, a 24-year-old female has suffered substantial burns when her clothing caught fire after pouring petrol on a barbecue. On arrival in the emergency department, she is intubated to protect her airway. Secondary survey reveals extensive burns to her chest, thighs and circumferential burns to her arms. After initial fluid resuscitation, the surgeons asked to take her directly from the emergency department to theater. For what reason do the surgeons wish to take this patient to theater? B. Perform a sclerotomies on her arms. C. K12, you have been asked to anesthetize an ex-premature baby, born at 32 weeks gestation, for elective bilateral inguinal hernia repair. His corrected gestational age is 60 weeks and he weighs 3.5 kilograms. He was discharged home 24 weeks ago without ancillary oxygen and has been well in himself. What would be your preferred anesthetic technique? A. Collar block with D. General anesthesia with collar block. E. Spinal anesthesia with sedation. K13, a 70-year-old male patient with post-central stroke pain has been on increasing doses of oral morphine solution. He is now taking 180 milligrams per day. It is decided to switch his opioid medication to an alternative in order to achieve better analgesia. Which would be an appropriate equipotent dose? A. Oxycodone 360 milligrams pul per day. B. Fentanyl 50 mg/gh patch every 72 hours. K14, you have admitted a patient with Burkitt's lymphoma to ICU from the hematology ward. He has been oliguric following his first dose of chemotherapy earlier today and his renal function has deteriorated significantly. A diagnosis of tumor lysis syndrome is suspected. Which of the following is not used in the management of tumor lysis syndrome? A. Forced alkaline diuresis. B. Allopurinol. C. Rasparicase. D. Renal replacement therapy. E. Dexamethasone. K15, you are due to anesthetize a 68-year-old woman with ischemic heart disease and poor exercise tolerance. She has an extensive breast lump, which the surgeon believes she can remove under local anesthesia. The surgeon tells you she will require a total of 80 milliliters of solution to cover the area during surgery. You have to make up the solution. Which of the following solutions would be appropriate for a 60 kilograms woman? A. 18 milliliters of 2% lidocaine, 2.5 milliliters 1,000 adrenaline, made up to 80 milliliters with 0.9% saline. B. 21 milliliters of 2% lidocaine, 0.4 milliliters 1,000 adrenaline, made up to 80 milliliters with 0.9% saline. C. A 45-year-old hemophiliac presents for a femoral nailing following enrita. His factor VIII concentration is 20% of normal and his hemoglobin is 100 grams L. Which of the following statements is true? D. Preoperative factor VIII levels should be 80% using factor VIII concentrate. In patients with liver disease undergoing surgery, a mortality risk can be estimated using the Child-Pugh classification. Which one of the following is not included in Pugh's modification of Child's criteria? D. Activated partial thromboplastin time. Activated partial thromboplastin time. Activated partial thromboplastin time. A 36-year-old multigravida is undergoing caesarean section following failed trial of forceps. Shortly after administration of prophylactic antibiotics, she complains of dyspnea, and the surgeon complains of excessive bleeding from wound edges. There is wheeze on auscultation, you administer oxygen, but the patient becomes more restless, cyanist and unresponsive. The likely diagnosis is, A. Amniotic fluid embolism, B. Massive pulmonary embolism, C. K19, a 10-year-old child with a history of weight loss, polydipsia and polyuria is brought into the emergency department with a pulse of 120/minutes. She is found to be drowsy and uncommunicative. Her blood sugar is 22, pH 7.02 and ketones are present in her urine. Which of the following statements is incorrect? A. High-flow oxygen via a face mask should be administered. B. Intubation and ventilation may be required. C. A bolus of 10-30 ml kilograms of 0.9% saline should be given. D. An actrapid infusion at 0.1 unit kilograms per hour should be commenced. E. The acidosis needs to be treated with sodium bicarbonate. K20, the development of chronic pain is due in part to the sensitization of dorsal horn neurons. Which of the following receptors is thought to play a central role in this process? NDA. E. A 50-year-old female is admitted to the ICU from the emergency department with acute liver failure. She has taken an overdose of 50 grams of paracetamol 24 hours previously. She has been adequately fluid resuscitated since admission. Which of the following criteria would make her a candidate for super urgent liver transplantation? E. Arterial pH less than 7.3 irrespective of grade of encephalopathy. K22, you are working on the obstetric unit and are called to see a 30-year-old primogravida with a BMI of 41. The patient is having regular contractions and the cervix is dilated to 4 cm. She is coping well on Itinox currently, but asks you if, and when, you would advise siting an epidural. Which would be the most appropriate response? D. Advise early epidural and IV access regardless of current pain level and airway assessment. E. An 8-day-old baby, born at full term, had an antenatal diagnosis of congenital diaphragmatic hernia and required intubation and ventilation shortly after birth. You are anesthetizing him for repair of the hernia. Shortly after the abdomen is closed, his blood pressure drops to 65/35 mmHg, heart rate falls from 145 to 90 bpm and oxygen saturations fall to 55%. Which of the following is the least likely diagnosis? A. Tension pneumothorax around the hypoplastic lung. B. K24, following a rapid sequence induction for an emergency appendectomy, you notice that the patient feels difficult to ventilate and has developed a widespread urticarial rash. On auscultation, breath sounds are equal bilaterally but there is widespread wheeze. The blood pressure is unrecordable, but there is a weak carotid pulse. Which of the following is the most appropriate drug treatment? B. Adrenaline 0.5 ml of 1 in 10,000 IV, hydrocortisone 200 mg. C. A phenytoin infusion extravasates from a peripheral cannula. You stop the infusion and disconnect the line from the cannula. The next most appropriate action would be to C. Aspirate as much drug as possible from the cannula. K26, a 25-year-old woman in early labor at term complains of right calf pain. Of note, she had developed a deep vein thrombosis in her previous pregnancy. Which of the following options is most accurate regarding the management of this patient? E. A thromboprophylactic dose of LMWH may be given 4 hours after caesarean section. K27, regarding pharmacological strategies used to protect kidneys perioperatively, which of the following statements is false? A. Dopamine may increase renal perfusion pressure and improve urine output. B. Dopexamin, when used perioperatively for vascular patients, does not protect kidneys. C. Volatile anesthetic agents may have a role to play in decreasing renal reperfusion injury. D. Cardiac surgical patients with early acute kidney injury, if treated with recombinant human atrial natriuretic peptide, may not progress to the severe form needing dialysis. E. Intravascular fluids along with prophylactic N-acetylcysteine have no role in the prevention of radiocontrast nephropathy. K28. The most common congenital cardiac lesion with an incidence of 35% is A. Ventricular septal defect. B. Urgent laparotomy. An 18-year-old man with small bowel obstruction is booked by the general surgeons for an urgent laparotomy. The patient has Duchenne's muscular dystrophy (DMD) and is confined to a wheelchair. He has a mild scoliosis and an FVC greater than 70% of that predicted. Which of the following pieces of equipment would be most useful intraoperatively? A. Neuromuscular monitoring. K30. A 45-year-old woman is to undergo a laparotomy for the removal of an ileocecal tumor. She reports intermittent episodes of flushing, hypotension, dizziness and diarrhea, especially when anxious. A 24-hour urine collection showed raised levels of 5-hydroxyindoleacetic acid. Which of the following perioperative measures will be of most benefit? C. Preoperative octreotide infusion. D.